My name is Peta Nims. I'm the Clinical Program Coordinator for Telehealth here at Swedish. The telepresenter is the healthcare professional that's been specially trained in order to facilitate a remote exam. People who are selected for this role really need to have good communication skills along with being really strong clinically and being comfortable with the technology. When a patient requires a consultation from a specialist, if they're not available in the community, then telemedicine can come in and breach that gap. In some situations, an interview between the patient and the physician is all that really needs to transpire, such as in telestroke. For more complex examinations, if you need to use those peripherals such as the digital ophthalmoscope, otoscope, stethoscope, and exam camera, then you are going to need somebody at the other end that can facilitate those physical components of the exam.
The one way to view this is that person at the patient's bedside is an extension of the doctor at the far end, and they work together to care for the patient.
The process for actually scheduling and performing a consultation has a lot of moving pieces and parts. An initial phone call is made from the attending physician to the specialist. From that phone call, a determination is made that yes, this patient requires a consult from this specialist.
The telepresenter's role is key in that they can provide information for me, important laboratory or imaging, things like MRIs or CAT scans, that really allow me to focus in preparation for evaluation of the patient.
The telepresenter educates the patient on what to expect during the consultation itself. Then it's time for them to gather the equipment and set it up in the patient's room. They check the cart, make sure the cart is functional. They have out all their equipment that they know that the physician is going to ask them to do. And everything is turned on and ready for when the physician is ready to remote in.
Good morning, Mrs. Williams. I'm Dr. Kushner at Swedish in Seattle. This is my ID. I'm a neurologist here. Kristen and I will be going through a series of tests this morning. So Kristen, let's start with the stethoscope and check the heart and lungs.
The telepresenter can function in a variety of ways to evaluate the patient. They can go through the examination that's routine. We can also work specifically together to focus the examination on what the patient may need. That's perfect. Hold right there.
Swedish has historically been on the forefront of telemedicine. We have built and refined the program based on national standards so that we can really bring specialty services to those areas or communities that typically would not have access to them.
The feedback we've had on our program is very positive. Patients and families feel as though their needs have been met. They felt like the quality of care has been very good, and in general, they've been very happy with the process.
The role of the telepresenter is a key component in providing greater access to quality care in your community.